Hello, everyone. Welcome back to WitnessTV. On today's podcast, I have with me here Dr. Serantha Foolchand. She is a pioneering fetal surgeon and gynecologist in KwaZulu-Natal. Among her many roles and titles, she is the head of the clinical unit at Gray's Hospital, the founding director of KZN Fetal Therapy, and an honorary lecturer at the University of KwaZulu-Natal. She has also been honored with many awards, most recently the 2025 Panache Woman of Wonder. And in light of it recently being International Gynaecological Awareness Day, she's here today to talk to us and share her amazing journey through medicine and her groundbreaking work and her passion for empowering women and saving lives through medicine and healthcare. Dr. Foolchand, thank you so much for being with us today and welcome.
Thanks, Jade, and thanks for having me.
That's a pleasure. So, yes, let's get right into it. And I want to start with, can you tell us about your journey thus far? What led you to pursue obstetrics, gynecology, and then ultimately, maternal-fetal surgery in medicine?
Okay, interesting question. So I think as a student, obstetrics and gynecology is one of the most difficult subjects. It's one of those that you just cannot figure out what's going on. But once I got into internship, and I remember from my last 4 months of internship, it all came together and I loved it. I spent from my last 4 months of internship up to now, I have only been in obstetrics and gynecology.
Okay.
And I remember many, many years ago, there was a doctor, he was Dr. Parks, he's late now, and he had a very keen interest, he's a radiologist, he had a very keen interest in scanning, and that's where in, the depths of Gray's Hospital, the ultrasound department it was on a Tuesday afternoon. I used to join him when he was scanning, and every Tuesday there was no signal. It was a dark space. And that's where my love for maternal and fetal medicine, arose. And obstetrics is such an amazing specialty because at the end of the day, it is so powerful bringing life into this world. It's such an honor. It's such a privilege. And something that I don't take for granted. And every pregnancy is a story, and being invited into that story, it's really absolutely rewarding. And that's basically why I'm here today.
No, I can imagine. I mean, I always say I'm not scientifically minded. I would never have done medicine, but something about gynecology and, that it's fascinating. It's so intricate and like you say, it must be mind-blowing and so complex. Was gynecology and that medical strain something that you kind of pursued from when you were studying, or how did you actually, you were saying that at first you're like, what is this? I don't understand it. Was it, what kind of made you push to actually pursue it and find that passion in it?
I think I loved it. From being an intern, then you start delivering babies, and it really all just comes together. And from those moments up to today, every single time I deliver a baby, it feels like a new experience. You feel the same joy. I tell my patients that even when I'm scanning, I could scan 1,000 babies a day, but it always, you still feel that joy, that little fuzzy feeling inside that you share with the parents as well. So definitely since I joined obstetrics and gynecology, that was where I knew my heart lay.
And then you've been recognized, you've pioneered a lot of fetal cardiac interventions and other surgeries in KwaZulu-Natal, and we'll touch on that later. But what exactly does it entail? I mean, when I think of operating, like fetal surgery, operating in the womb on a fetus, it's like, it gives me like, my hair raising. It's like, oh my word, I want to hold my breath. It sounds so scary and intricate. What exactly does it entail, and what kind of conditions do you treat in the womb?
So, fetal surgery basically is being able to operate on the fetus prior to birth. And I think there are so many conditions in the first world. There are many, many conditions that can be treated via fetal surgery, such as spina bifida, so abnormalities in the spinal cord, complicated twin pregnancies. There are really so many. It's just that we are only starting here in South Africa, and it is definitely a work in process. I've had to go overseas and do a lot of training. So we are definitely starting with the simpler, more basic kind of procedures. But I think we are now in a space where we can almost be comparable to first world standards, that we can now bring new technologies to South Africa and the African continent, because ultimately we want all our patients to be able to receive the same quality of care.
No, definitely. So you said before that you kind of started going into obstetrics and you kind of fell in love with the whole idea of, fetal medicine when you were at Gray's Hospital and involved with the scanning. How, since then, how has that shaped your career and also led to, your sole focus now with the KZN Fetal Therapy? How did that journey come about?
So I had obviously training starts as being a registrar. You may be trained to become an obstetrician gynecologist, and then I did a further specialization to become a maternal and fetal specialist. And as time passes, you become more ambitious, and whatever you do doesn't seem to be enough, and then you move on to the next milestone and the next goal. And now in maternal and fetal medicine, I think the next level is fetal surgery and minimally invasive fetal procedures, and that's progress.
So tell me about KZN Fetal Therapy specifically. When did you launch that?
So in 2023, I have been a maternal and fetal specialist for many years and an obstetrician gynecologist for many years. I think there was a need for my services in the private healthcare as well. And so therefore, I'm doing both public and private work. As a fetal specialist for Pietermaritzburg, I am in this western half of KwaZulu-Natal. I am the only fetal specialist.
So you must be very in demand.
Yes.
And I mean, do you have any stories, like highlights of cases that you've worked on that really stand out, that, maybe complicated surgeries where the outcome was like, a real...
There are so many. There are really so many. But some of the things that stand out to me are, for example, I had a patient, and this was at Gray's Hospital, and that's what also makes it so much more meaningful as well, because I'm treating a range of patients from public and private sector. And this patient, we had delivered her baby a little bit earlier than usual because she had previous poor outcomes. And in the corridor, she met me and she said, "Doctor, do you remember me?" She said, "I have to tell you that for the first time I ever heard a baby cry," and she says, "It was thanks to you." And I felt, it is really so heartwarming to hear that from patients and their appreciation. And we don't actually realize what patients go through and their mental trauma and anguish, and especially in a case like this where she had so many poor pregnancy outcomes. She had never had a live baby. And to say, for the first time I heard a baby cry, that was like a moment that I will not forget.
That's really touching.
And as much as all the other advanced work is so important and our outcomes are good, but these are the kinds of cases that are so meaningful because you are really impacting someone's life in such a positive way. And I had another patient, they've kind of become friends now. She came to me in her first pregnancy. She was referred from another gynecologist because she had extremely high blood pressures and he was concerned about her. And the moment I put the probe on the patient, I realized that the baby had passed away. And the thing that impacted them the most was how I conveyed that message to them. And she actually spoke at this Women's Day conference, and she mentioned that although they had a poor outcome, but what mattered to them was the care that I took and how I conveyed the message. And she remembered the exact words that I used.
Sure.
So, and fortunately, subsequently, I took care of her in the next pregnancy, and we had a good outcome. And those are really the kind of cases that impact me the most, because I know that I'm doing my job to the best of my ability.
And that's basically leading into my next question, which is basically that you are, as a gynecologist, as a doctor, you're more than that. You're part of this journey with parents, bringing life into the world, which is the most amazing miracle. And yeah, it's a journey of hope, and at times, like you said, heartbreak. How do you navigate that relationship? Obviously, you're a doctor and, you're focused on the medical aspect, but then at the same time, you witness to this amazing joy, and I'm sure, like you say, every case sticks with you. It's hard not to be personal when you're part of this journey, and you have to be, you focus on the medical aspect, but then at the same time, you're very much involved in this really personal journey and relationship. How do you navigate that?
That's a tough one. Okay, so I think, part of what I do, it is walking the road with the patient, in the highest of hopes and in the deepest of their fears, and being a companion, partnering with them on this journey. And besides just cutting edge medicine, but it's about being compassionate, about the counseling, the quality of care that we give patients, and empowering patients with regard to what is going on in their pregnancies, and taking care of that. So, very often medicine teaches us a little bit of detachment. And I think maternal and fetal medicine demands compassion as well. So I think we have to find the balance between both, providing the best care, the most up-to-date care, but also providing compassion and kindness and love to patients, so that they are empowered to make the best decisions, and that they don't feel alone in this journey.
So I guess it's just the way you go about delivering that medical approach. It's fueled by compassion, and
100%.
And then, you sometimes, like you did mention, when outcomes don't go as planned, and through those moments of absolute helplessness, how do you manage that and that emotional responsibility, and that emotional weight that you also, you've been on this journey, now you have to break this news or to the parents. How do you go about that? How do you manage that?
I think those kind of moments weigh very heavily on me, and it is never routine. So what I would, I definitely lean greatly on faith, reflection, a good support system, and being transparent with patients, talking to them about what has gone on, why. Some outcomes are inevitable, that it may not result in a live birth, and it's because the moms may have severe medical conditions, and there are other factors that impact the pregnancy. So it really is about, having faith, having people who support me, and so I can be that support for my patients as well.
Yeah, that's a very good point. And I like what you said about transparency, because I think ultimately, and you said before, part of your role is also to empower your clients, patients. And I think that goes hand in hand, because when you can actually be able to explain and be transparent, and it's, sometimes it's tough and it's hard to, but that obviously, that develops that trust between the patient and you, and you're also empowering them with knowledge to understand why, and then they can kind of see how it goes.
And it is part of our duty of care as part of the healing process, to ensure that patients do understand what has happened and why. It's part of their healing and our own.
No. And then, in 2016, you were part of a groundbreaking surgery at Inkosi Albert Luthuli Hospital. Can you tell us a bit about that and the significance of it?
So it was minimally invasive fetal cardiac procedure. And basically, I think, what it really means is that we are able to advance, technology is advancing, medicine is advancing, and we are able to keep up to date and keep up with it. And, to be able to try and provide advanced care outside of international centers, I think it's quite monumental and groundbreaking, and it's the direction in which we are moving, and it's a good direction that we are moving in. So although we may still be a little far behind, we definitely are not up to date with all of the international standards, but we are getting there, and I think that's important to be able to bring it to the African continent, and for all women to be able to have access to this kind of healthcare, which I think is so important.
No, definitely. And, it's really awesome that you've gone and you've, gone overseas, gained all this knowledge, and you're bringing it back home to KZN, to Pietermaritzburg, and like you say, all women, to private healthcare and also public healthcare, so that everyone, no one is left behind. I think that's really important as well.
And it's translating hope into action.
I like that. And so you've pioneered all these medical advances, and you've been part of that process of saving lives, and I think you did touch on this a bit before. But for you personally, what does it mean, being a maternal-fetal specialist on that human level, beyond the science and the surgery? What does it mean to you?
I think it's just about hope. If I could use one word to describe it, then it's hope. And it's, on the one hand, it is so scientific, and on the other hand, there's so much of vulnerability and resilience associated with it and this job. And definitely, I think hope is the one thing that I would say that's what it means to me, that there's hope for all women and their unborn babies.
That's a word that you keep coming back to, and it's such an important and inspiring word. And to know that in your field, you're bringing that, and that people are receiving that, we all need that.
And, at the end of the day, medicine is not just a career, it's a calling. And that's the way I look at it.
Oh, great. I've been listening to you describing your journey with parents, and through these moments of uncertainty and joy and heartbreak, and it really highlights that deep role that gynecologists play in families and through their patients, in people's lives. And it's, like you say, it's beyond medical care. And I think, this feels like an important moment to reflect on. We've just, this month on September 10, International Gynaecological Awareness Day. And that's a reminder of the importance of women's health, and that it's not only about treatment or outcomes, but it's about dignity and awareness and compassion. So in light of that, Dr. Foolchand, from your perspective, what's the importance of commemorating an awareness day like this?
So I think it's really important and it matters because for a long time, women's health issues have been dismissed or overlooked. And I think it's important, especially in South Africa, where there's so many inequities to access of care, to be able to provide a national dialogue to address all of these issues and to help, to empower women and to advocate for them and their health.
Definitely. And what are some women's health issues that you think still need to be amplified, especially in a South African context?
I think one of the things women accept is pain. It's like pain is normal and you just have to get over it. And that's what society teaches us. You know, you have pain, it's fine, it's normal, just move on. Here's two Panados and,
Seriously.
move on. So I think, we definitely need to change that. Conversations about things like menopause, reproductive health, they are so taboo and not really spoken about. So I think those are definitely misconceptions that we can change, and those misconceptions perpetuate neglect because we neglect ourselves, neglect to seek help, and it's just a perpetual cycle, I would say.
No, definitely. And that's, you talk about empowering women, and healthcare, women's healthcare is one of the basic ways to empower women, because
Absolutely.
if you're living in pain and you don't, it's misdiagnosed or it's overlooked, because I read there's so much research saying that, women's issues are misdiagnosed because they just overlooked, or, take a Panado, you're in pain, it's okay.
And don't seek help timeously.
And don't know that you can seek help, that this is actually not normal, because we're so used to living with abnormalities that's really important point. And how can we go about, from a medical, within your industry, from what you see, from your perspective, what are ways that we can change, break those stigmas, fight those misconceptions, and actually just empower women?
I think just starting with conversations like this. Over this last month of August, I've been involved in so many women's health organizations and conversations, given many talks, and I think that's a place that we can definitely start. It's starting simple, but it can have a huge impact. If you could just reach one person every time you speak, that person will go and pass on the message to somebody else. And I always say, whenever we speak, there's a message for somebody in there, even if it's not necessarily you. It could be for your daughter, for your mom, for your aunt, for your sister. So definitely having these conversations and to do it in a way that reaches women and reaches women at all levels of society. So even in clinics, whether we are in the rural areas or whether we are in the most affluent areas, we should be able to go out to speak to women and empower them to seek help if they need.
No, definitely. It's just getting that message across using all the platforms, and now with social media and print media as well is very important for the communities.
And it's a lot easier to do so, with social media. And almost everybody is on some form of social media or the other. And although I'm very old school, but I know my patients come and tell me, yes, they've Googled me and, they've read this about me or that. And so it is a powerful way to reach people. And if us as healthcare workers keep the conversations going, then it's a small way that we can start to reach people.
And like you say, yeah, it's the emphasis is on keeping the conversations going. It mustn't just end in August or, we have a big hype over September 10, Gynaecological Awareness Day, and then it also inspires us to say there's so much more. Let's actually reflect and see where we are and where we must go. And so if you had to, deliver one, you said you've spoken, you've done a lot of talks throughout August. What would your key message be regarding this Awareness Day and the importance of women's health? What would you say if, you're talking to all our women listeners out here today?
I would say your body's voice matters.
I love that.
And listen to it. So if you need to seek help, you should do it. And don't apologize. Don't be apologetic for seeking help and the care that you need.
No, that's so true. I think especially
and honor your body.
I love that because I know it's so easy to just shut off, not listen to your body and I think women have so many different pressures, and it's like no, I'm just going to do this. I'm going to keep going, and you don't listen. You ignore the red flags, and like you say, prevention is the ultimate.
Absolutely. And I always say this, women are good at two things, taking care of our families and neglecting ourselves.
That's
so, therefore I say listen to your body, and your body's voice matters.
And don't feel guilty. Don't feel guilty to take that time for yourself. That's
definitely. And self-care is another thing that we neglect greatly. And I think just if we talk about self-care, people think that, you're talking about should you go on a spa date or, coffees with your friends or whatever. But self-care is also just, being able to sit in the morning with your cup of coffee and enjoy it before your family wakes up. Self-care is also going to a gynecologist.
Yes.
Self-care is a breast examination, doing a pap smear. So those are various areas of self-care which are so underrated and yet so necessary.
Literally taking care of yourself and looking out for yourself and listening to your body and on every level. No, excellent. That's great advice from you, and I think all our listeners will. It's something that we all need to be reminded of often. Let's get back to you. And we touched on it earlier. You are balancing that. You're doing a lot. You have a lot of roles. You're at Grey's. You're directing KZN Fetal Therapy, and then you're also lecturing. How do you juggle all these responsibilities? And then still find time for yourself, like we just spoke about. How do you juggle them? How do you find balance? And what have you learned? What are some of the lessons that you've learned along the way on how to cope?
I think one of the important things for me is not seeing them as separate entities, but just threads of the same fabric. Okay. And, that's the way I look at it. I love teaching, but teaching sharpens my practice as well. Mentoring the next generation of specialists means that we have hope for the future generations. So definitely it's not very easy, but somehow rather than looking at, the balance is realizing that each thing fuels the other.
So they're all connected and they're kind of, stimulating you and driving you, and your main purpose, bringing hope, you feeling that.
Yes.
That's great. And I think you've also, we were chatting earlier about, your many accolades. So you've received, there's some prestigious ones. Let me just read them out. The MEC Award, which I know, it's the MEC Award for Service Excellence. That was in 2016. the Premium Prestige Award in 2024. And then you've been awarded the Panache Women of Wonder for 2023 and again this year. Congrats.
Thank you.
So what do these recognitions mean to you? And also, to the broader women's healthcare, that field. How do you respond?
I think, I'm very shy when it comes to that part of, I still have to get accustomed to it. I think really they are affirmations of the work that I do, not just me, but my team, because we don't really work in isolation. And for that moment, yes, it's great. And it's great to have recognition. And if it can impact somebody's life, that some women out there could look at me and think that, wow, maybe I could do this, then that is, I think, where I would think it's most meaningful to me. But I must say that medicine is a very humbling job, and really it is the bigger picture that matters more, which is doing our best, being my best every day for my patients. So as much as the recognition is good, but I think it's not something that one should dwell on. We have to move on from that to the more important things.
Oh, definitely. And I like how, you've put it, you're passionate, you're just working, this is your calling and you're doing that. And the recognition comes as a result of just your focus and your dedication. So your focus isn't on that, but on, what your purpose is. And also what you said about, I can see you're very passionate about inspiring the next generation of gynecologists. And it's great. It's nice to be part of that. Yeah.
Thanks.
And then on top of all, your busy schedule and work, you also, I believe, are involved in a few advocacy campaigns for Down Syndrome South Africa and the Rise Up movement. Can you tell us about that?
Okay, I think it's so important. I think advocacy is also part of my identity. And they are marginalized communities, and it just reminds me daily that, it's about inclusion, dignity, and amplifying voices of the unheard. So, medicine shouldn't exist in exile from society. And I think that is why these are two foundations that are very close to my heart. And for example, Down Syndrome South Africa, I do a lot of talks for them. And really, because I work with patients and we have to talk about Down syndrome on a daily basis, the moment they hear these words, they turn pale because they have not been educated. They don't know what it's about. And there are people living in our societies with Down syndrome who are such an important part of our society. They are loving, they are caring, they work. And I think it's important that more awareness is created in that regard. And the Rise Up movement, they are just brilliant and amazing. They deal with rape survivors as well as, child trafficking and so many other areas. And I'm a liaison for them.
Okay.
And I think really advocacy basically transforms clinical work into real societal change, and that's what it's about.
Oh, that's excellent. Yeah, and it's, I think, from like you said, you're dealing with Down syndrome, you're dealing with these cases in in that clinical setting and having to explain that and bringing it that holistic vision and view of bringing it. Using that experience to actually just advocate for what you see daily and just making it less taboo. I think that's
yes.
Oh, that's excellent. Yeah, well, all the best with all of that as you continue.
Thank you.
We've touched on your career and everything you've done thus far. Looking to the future, have you got any projects or areas that you're
So I think just looking ahead, going back to this minimally invasive in utero procedures and surgery, that is definitely something to look forward to. Uh, you know, as I said, technology is advancing exponentially, and even scanning and imaging in maternal health is changing so much. So I really do look forward to all of that. I look forward to the fact that we are breaking barriers and that we can bring all of this innovation to South Africa, to all of our patients. And I look forward to be able to offer this to everyone. And I think that is definitely next.
And then lastly, do you have any advice for our younger listeners who maybe are interested in pursuing a medicine field and a specialized field like yours and gynecology? What advice would you have for the younger generation?
I think the one thing I have to say is that medicine will test you, but it will also transform you. And, know that your voice matters, and especially in rooms where women are underrepresented. So, to women out there, choose courage over comfort. Be monomaniacal about your vision, and your best work lies outside the safe harbor of the known. So, we should always endeavor to be our best, and to do your best and to reach those heights, even if no one believes in you, believe in yourself. I think that is so important. And as much as medicine is so scientific, but your true power also lies in your empathy.
No, I love that. That is excellent advice. I hope all our younger future doctors are listening and taking notes. And for everyone, I think, yeah, that's excellent advice. And I believe that you are a finalist. You've been nominated for the Best of Peter Maritzburg Reader's Choice competition.
Yes.
So please, all our viewers, get voting. The link should be on the screen. And vote for Dr. Serantha Foolchand for what's your category?
Best gynecologist.
Best gynecologist. Vote for
Yes.
Dr. Foolchand for best gynecologist in Peter Maritzburg. Thank you so much again, Dr. Foolchand, for being with us today. It's been really inspiring and amazing to hear about your journey and your amazing work that you're doing. Thank you. We're all inspired. Please keep it up.
Thank you, and thanks for having me.
It's a pleasure.